Hi, I'm Ivy McGregor. Thank you for participating in the Centers for Disease Control and Prevention's Hairstylists, Barbers, HIV Prevention Initiative. This initiative is part of the Business Response to AIDS, Labor Response to AIDS program and is designed to mobilize hairstylists and barbers in support of HIV prevention. As a hairstylist or barber, you have a great amount of influence. You have the power to stop the spread of HIV in your community by increasing the number of people who talk about HIV, who get tested, and who seek care. So some of you may be wondering, what's in it for me if I join the initiative? I'm glad you asked. As hairstylists and barbers, you should get involved because it can protect your business. You can help save lives. Research suggests that clients prefer to support businesses that show they care about their community. You can reinforce your position as a leader within your community, and it's the opportunity to join a national movement. Barbers and hairstylists from across the country have undergone this very same training and are now actively participating in the initiative. Participating hairstylists and barbers are sharing HIV prevention messages with their clients and employees, referring people to testing and care services, distributing HIV materials, hosting shop talk events, and hosting free testing events. So by the end of this training, you will understand how HIV/AIDS can impact you, your business, your clients, and your community. You will know and be able to share HIV/AIDS facts to reduce stigma and myths. You will be ready to talk to your clients and staff about HIV/AIDS. Many people believe HIV in the United States is no longer a serious problem. However, many of you have shops in areas that are heavily impacted by HIV/AIDS. In 2009, CDC reported that there were more than 48,000 new HIV infections in the United States. Nearly 1.2 million Americans are living with HIV, and 1 in 5 do not know they are infected. Blacks make up 14% of the population, but account for nearly half of all new HIV cases. 1 in 16 black men and 1 in 32 black women will be diagnosed with HIV within their lifetime. In 2009, Latinos accounted for 20% of new HIV infections in the United States, while representing 16% of the total U.S. population. Now, let's take a look at how one of the stylists is promoting HIV prevention.
Good afternoon, how are you?
Hi, I'm good. Just trying to stay sane between school and work. This is my only time I have to come see you, get my hair done, and just relax. Hey, what's stopping AIDS is everyone's business?
Stopping AIDS is everyone's business, and it's going to take everyone and everyone's actions to stop it. Stylists and barbers just like me all across the country is working with CDC to get people talking about HIV, to get them tested, and most important, to get them treatment about this dreadful disease. You know, it's going to take all of us to get it done.
If left unchecked, the HIV epidemic can have a tremendous impact on your business. If your employees aren't educated about the facts or know their status, they may discriminate against persons living with HIV or may even contract the disease themselves. Before talking with your clients and staff about HIV, be sure to get the facts. Now, each of you can help stop the spread of different myths and stigma associated with HIV. Now listen, we don't expect you to be the expert. Basic HIV/AIDS information will be provided to each of you in a quick tips reference sheet. And you can also display this on your workstation mirror. You'll receive this sheet along with other materials following the completion of the training. Now let's get started.
What is HIV? HIV stands for Human Immunodeficiency Virus. HIV is the virus that causes AIDS. There is currently no cure for HIV. However, there is treatment available to help people stay healthier and live longer. HIV can be found in body fluids. blood, semen, vaginal fluids, and breast milk. HIV cannot be transmitted by saliva, tears, or sweat, from a toilet seat, nor through casual contact, such as handshaking, kissing, or sharing eating utensils. What is AIDS? AIDS is acquired immune deficiency syndrome. AIDS is the late stage of HIV infection. There is currently no cure for AIDS, but there is treatment to help people stay healthier and live longer. How is HIV transmitted? By having unprotected sex, vaginal, oral, or anal, with the person who has HIV, by sharing needles with someone who has HIV, and during pregnancy, birth, or breastfeeding if the mom has HIV and is not treated.
Let's go to one of the barber stations and see what they're talking about with their client.
What's up, man? Man, I ain't seen you in a minute.
In a good minute, man.
What's good?
I'm good. Everything's good.
What's new, man?
Man, everything's good, man. Work's going good. I'm liking it more and more. And I kind of got somebody that's catching my attention right now.
Oh, okay.
Yeah. We've been vibing for a couple weeks, but we kind of hit a little hump, though.
Hump? What kind of hump?
Well, she's ready to take it to the next level with me, but before she does, she asked me to be tested. I don't really know how I feel about that.
I don't think you should feel a certain kind of way about it. I mean, this day and age, you got to think about it. I mean, she's just looking out for you and her well-being.
True.
If you ask me, you should be happy she even cares.
True.
Man, there's a lot of stuff being passed around like HIV. And if you think about it, man, people don't understand all the risk involved.
Did you notice the barber mentioned different risks associated with HIV?
HIV prevention challenges include high rates of undiagnosed and untreated sexually transmitted diseases, also known as STDs. Someone infected with STDs is 2 to 5 times more likely to get HIV than a person who doesn't have any STDs. There's lack of access to high-quality health care, housing, and HIV prevention education. There's lack of awareness of personal and partner's HIV status, and stigma, fear, racism, and homophobia may prevent individuals from seeking testing and treatment. Risky behaviors include having unprotected sex with multiple partners or partners you do not know, having unprotected sex with the person who has HIV, by sharing needles for injection drug use, and also drug and or alcohol use can impair judgment and contribute to increasing the likelihood of participating in high-risk sexual behaviors. Ways to reduce HIV risk include to always use a condom, limit the number of sex partners, don't abuse drugs or alcohol, which can impair judgment and lead to sexual risk-taking behaviors, do not share needles, get tested regularly for HIV and other STDs. If HIV positive, seek treatment and talk about your HIV status with your partners.
Let's chime back in for a little more.
Man, the CDC recommends that if you're between the ages of 13 and 64, you should be tested at least once in your lifetime.
Really?
Yeah.
Well, I guess I'm past due on the testing. But I feel you, man. I guess I'm just a little nervous.
Yeah.
But you know what? I'm gonna go ahead on and be tested. I mean, I do like her. I like for her to stay around.
Man, that's what's up, man. They say if you know better, you'll do better. You can always go to HIVtest.org, type in your zip code, and they'll give you a list of testing locations near you.
Okay.
Man, people have to understand that even though they're living with the HIV virus, that, there's still hope. I mean, check out Magic Johnson. Man, Magic was diagnosed with HIV over 20 years ago, and he's still living life.
Yeah, but Magic was probably cured by some magic potion or something.
Man, he Magic Johnson, he's not a magician. He's taking the same medications as regular folks. You know what? There's medical treatment for all those who suffer from HIV. They can treat it just like any other chronic illness, like diabetes or high blood pressure.
Really?
Yeah. Medication, exercise, and living a healthy lifestyle are all key in maintaining a long life with HIV.
Okay.
You know what? Matter of fact, we got a test crew coming in next weekend, man, for the HIV awareness community event. You should come get tested.
Definitely.
Man, that's what's up.
The barber handled that conversation quite well, and you can too. Another great way to talk with your clients is by using current events and pop culture. Let's see how another stylist is handling this conversation. Hey,
Hey, that's that Marsha Ambrosia CD. Have you seen that video?
The concept of that is actually brilliant.
Yeah, I saw it, but I didn't get what was so brilliant about it. I just thought it was another song about sex.
No, the concept of it is actually encouraging us to practice safe sex, encouraging us to get tested and to know your partner's status. And that's very important because of all of the STDs that are out there and HIV and AIDS. That's what the positive and negative signs were for in the video.
Really? I didn't get that at all. But you said HIV and AIDS. Aren't they the same thing?
Well, I don't know everything about it, but I do know that HIV is the virus that causes AIDS. And I know that you have a hot date tonight, and I want you to be careful. So now don't hesitate to ask him his status because you have to protect yourself.
Very nice.
Thank you.
So it's okay if you don't know all the answers to the questions that people may have. We don't expect you to be HIV experts, so don't hesitate to refer to the Quick Tips reference sheet or to distribute palm cards to your clients. To locate the nearest testing site that provides free, fast, and confidential testing, visit www.hivtest.org. If your clients or staff have more questions about HIV and the impact it can have on a business, refer them to www.hivatwork.org. To receive more info via the web on HIV, visit www.actagainstaids.org. You can also call 1-800-CDC-INFO for more information on HIV and other health-related issues. We also encourage you to take advantage of using social media, Facebook and Twitter, and your website if you have one, to promote HIV prevention. Using social media expands the opportunity to increase your involvement, gain more visibility, and grow your business. If you're on Twitter, you can follow and retweet prevention messages from the CDC Twitter hashtag #TalkHIV. Download and display the different types of buttons, badges, and widgets from CDC's Act Against AIDS campaign website, which is www.actagainstaids.org, onto your business's website as well. HIV/AIDS is something we can win by working together. All participating stylists and barbers who join the initiative and complete the training will receive a certificate and also a starter toolkit, which will include an overview of the initiative, palm cards to distribute, quick tip reference sheets, which contains the basic facts and referral information. It will also include a Stopping AIDS is Everyone's Business t-shirt and cape, along with the calendar highlighting awareness days to promote HIV/AIDS prevention. With the calendar, all participants are being asked to use the materials every first weekend of the month, along with other national HIV awareness days. We are asking you to distribute materials, promote testing, and use the capes and host shop talk events. So remember these three things: talk, test, and treat. Talk. Take advantage of teachable moments by using the capes. Test. Encouraging your clients to get tested. And treat. Encouraging those living with HIV and AIDS to get treatment. Because
Stopping AIDS is
everyone's business.